So the Eastern Regional Network, in partnership with the Literacy Network of Durham Region, got together, and we were really taking a look at sort of the evolution of literacy and basic skills training and where we are today. And one of the things that we sort of as a network came to the conclusion was that the literacy and basic skills programs had a vital role to play in offering more employability training. And specifically, we were looking at occupational health and safety. One of the reasons that this was one of the training initiatives that sort of rose to the top in our conversation was that with the new legislation mandated by the Ministry of Labour around health and literacy training, we felt that this was perhaps an employability skills training where clients and learners were vulnerable. And when I say that they're vulnerable, we know that 42% of people in Ontario have literacy and basic skills issues. Therefore, the current methodology that's being used to train people in occupational health and safety is primarily online learning, as well as classroom-based. But the level of information that's being presented to the clients, the level of language, is difficult for people with literacy issues.
Hearing about Joan's initiative, or hearing about the initiative in the Peterborough area, sort of piqued my interest because I recognize from being involved with a number of other programs that health and safety is increasingly a concern for those people who are entering manual labor or service sector jobs. In fact, health and safety touches on all aspects of people entering the workforce. And most of the people that we're seeing in literacy programs are really having difficulty competing against college or university graduates or people who have specific certification or training. So I thought this was a great opportunity to start to investigate how we can make literacy and basic skills training more functional, more purposeful, and include those sort of highly coveted wallet cards that people are looking for when they want to access training.
Trent Valley Literacy Association, commonly known as TVLA, has been in the community since 1978. We are the community leader in adult literacy skill development. We're actually the delivery partner for this project, Health and Safety. We've had experience in the past doing some work in health and safety, and we really think that that's the key component because it doesn't touch just one particular target group. It touches many target groups. We have people who are unemployed from the age of 16 to 64 and maybe never had really very good health and safety training or had any health and safety training. So we think this is such a benefit for what our community actually needs. The other thing it has done for us is we have found that once people walk in the door to have this training, they see what our organization actually does, how inclusive our actual environment is, how easy it is to learn in this environment. There isn't one bit of cost to them to be able to attend this program, and they actually benefit from doing that. Once they're in the building and they see, the staff is fabulous with everyone, the process is not overwhelming for them to learn, they actually think that they want to come back. So we have had several people in this health and safety course approach us who either want their GED, they want computer training, they want a one-to-one tutoring in terms of maybe they have a math deficiency. So they actually do come to the program, come back into our program, and they've expressed that interest, and that'll happen as soon as they're finished with the health and safety training.
I really think that injury prevention and health and safety it's a crucial piece to getting ready for work. I think that if we can have employees who get to go to work and then come home safely at the end of the day, I think that's crucial. I think some of the other skills can be taught at the workplace, but I think sort of having a real sense of awareness around making sure that you stay healthy and that your colleagues stay healthy is important. And from a service coordination point of view, I really think that literacy and basic skills as well as employment services can work together to serve common clients, and both agencies would be taking a look at making sure that they have a skill set that really help them be safe at work, and also to take a look at what kinds of jobs would be most suitable for that person. One of the big misconceptions is people tend to think of literacy as an on-off switch, whereas we know that really people are literate, but they need to be more literate if they're going to be prepared for work and remain safe at work.
One of the downsides when a worker is hurt, you no longer have that worker's expertise at work. So for the employer, It's a huge cost. How do you suddenly replace somebody that was doing a great job yesterday and tomorrow they're not here to do that? Somebody's got to find that resource. Better still, why don't we protect the worker that's doing that and make sure that they are receiving all the support they need to continue doing the job they're doing. You know, the average cost of a worker getting hurt somewhere around $21,000. That's a huge cost to the employer. There's another factor in there we talk about is indirect costs, you know, replacement costs for that worker, dealing with administration, dealing with the Ministry of Labor. It's about an $84,000 injury every time a worker's hurt on average. Well, somebody's paying for that. The worker pays for it through pain and suffering. The employer pays for it through loss of productivity, through this loss of revenue that's coming in. It's got to go somewhere. So in the ideal world, looking at it in the overall picture, is health and safety is so important, not just for the workers and keeping them safe, but also for the employer to allow them to be productive, to allow them to continue doing their work and making sure their workers are well prepared and well equipped.
Being a pilot project, we've identified some of the different areas that would be good to cover with prospective employees. The particular subjects I've covered were worker health and safety, hazardous materials, so WHMIS, also hazard identification in the workplace, and also be touching on harassment, violence, and accessibility in the workplace. So I've gathered a lot of the applicable material from the Occupational Health and Safety Act and different acts, and tried to develop it and put it together in a form that's engaging. It's not just somebody standing at the front of the classroom regurgitating the material, but also making it interesting for the students as well. So I think we've had a really good response so far. A lot of them have come from a variety of backgrounds, and some of the discussions we've had in the classroom, it's been interesting to hear some of their previous work experience. There's been a little bit of a lack in health and safety training in some of their past, so it's been interesting to see some of their I guess surprise at what the regulations actually are and what they should have maybe been practicing in their previous workplaces, so they know now going forward that what they should expect, what their rights are, and also what their responsibilities are.
One of the big parts of this program, for example, is first aid training. Now, it has a great job component. You are not getting in a career now, certainly in a career in a factory or in a restaurant, without showing up with a standard first aid or some sort of first aid certificate with your name on it. That's fundamental now. But beyond that, you are a big component, you are a big advocate for your community now with this first aid training. And I say this as a professional rescuer. Firefighting is my career. And firefighters like to say that they save lives, and in fact we do, and I'm not going to deny that. But when we step off the fire truck in a medical emergency, which is the predominant call that we go to, when we get off a fire truck and we see a bystander providing care for an individual, we get big smiles on our face. Our mood goes up because we know we have a good chance of getting that patient to the hospital alive. The people that are in this program, when they leave this program, they become healthcare advocates for their community.
So I run the students through a standard first aid program, which includes CPR and AED training. So I come in for the 5 days in total to run them through that and cover off all their first aid skills. A lot of jobs have a requirement to have some sort of first aid training, so it's nice to get them to have that before they go and apply for the jobs, and just to make them a lot more confident with the skills that they might have to do. Because if you're more comfortable with it, you're more inclined to help. So if they have more of an understanding, so a more thorough understanding of what it is that we're actually talking about and different wounds and different medical conditions that they can encounter, I think they would be much more likely to actually help.
So some people might ask, why are a group of firefighters and emergency responders and trainers running this program? We're not running it, we're part of it. And really with the Literacy Association and with some community college partners and employment partners, we're one ingredient. And the unique thing that I think we offer, we've seen the accidents. We've seen where people have refused or not known how to address a safety issue until it comes to losing a finger or till it's come to them falling down a set of stairs because they weren't properly maintained. So we were able to give very clear real-life examples, and then drawing our experience from different avenues of training, we were able to make it interesting, real-world, look at how to make change in a positive, constructive manner, and ultimately it's about these people feeling the confidence to go out, be employed, and then maintaining that employment. So if there's any industry that knows something about empowerment, I think it's fire and emergency services.
So there's a real real diversity when it comes to the ages of the people that we have in there now. It's not just all young people, it's people from all different ages. And what is wonderful about this particular program is that it's also a real mix in gender. So we have sort of 50-50 male-female, difference in ages, difference in education level as well as their literacy levels. So that's really tough when you're going to put together a program and you're dealing with all different levels. I can say that they've done an excellent job. The instructors are fantastic. And one of the things that they were talking about earlier is the fact that they also did the resiliency training, and they did a beautiful job on that. The other thing that I find that they're doing a really good job on is the hands-on partnership, team building, working as a team. One of the things that they were mentioning that I wanted to mention, I think is so important, when they were doing the resiliency training and trying to get their confidence up, one of the instructors spent a lot of time on the handshake and eye contact and how to breathe properly when you're stressed, things like that. Well, I can tell you that for 2 weeks after that, they were still talking about it. They were saying, do you know that when I went for my interview yesterday, I listened to what you said, and when I shook that man's hand, I looked right into his eyes, and I know that there are 2 students in particular that now have a job. And I think they say that this really helped them, and that gave them confidence for their interview. So I think that's huge. The other thing that we did with the students is we took them to Sir Sanford, and they did a safety audit. Half of those students had never even been in a college before, and they were quite intimidated. By the end of that session, they were walking on air. They just loved it. They loved being in the college. They loved walking around with their clipboards and assessing things. They loved the chat afterwards with Joan about, second career. And from that, they got excited about further education. You could tell by the way they were talking. So I think we mentioned earlier about how it's not just about the card. It's not just about health and safety training. It's about being excited about learning. And I can tell you, I've seen it firsthand how excited they are and how engaged. Because the difference between day one and where they are now is night and day.
I had taken 2 years off. I'm a personal support worker. I'm certified for that. I plan on going back into the field, and I wanted to update all my certificates. My first aid, CPR, WMIS, that sort of thing, and I was told about this through the Employment Council Agency, and that's how I ended up here. I'm updating all my certificates to go back to personal support work. It's been wonderful. The teachers are great. All the staff are really, really, really friendly, and they make you feel really right at home. And I really enjoy coming here because I'm learning everything I need to, getting my certificates updated, so I'm really enjoying this program.
The teachers, they are really helpful, and the good students help me a lot. My English not really good. Writing and the test, they all help me a lot. Really appreciate for that.
My dream is to get into a workplace environment which will allow me to take all the knowledge I've learned in this class, put forth what I know intact.
I've been in places like this before, never really got into it. This is the first one I've been to where I actually feel like I'm learning. The main thing that I'm learning right now is about workplace safety, which is, with the work that I do, is a very important thing because I work around lawn equipment like big tractors and all that stuff. So what I'm learning here about the health and safety and WMIS and all that stuff is a great thing to learn. I have my first child on the way. We found out actually last month. So my plan right now is to get as much training as I can, get myself a darn good career, and be able to support my family and have a happy, healthy family and an enjoyable life. So TVLA is the place to be to upgrade your skills and help you move ahead in life.
And when you do not have literacy skills as the rest of society does, you tend to, your sense of self-confidence is a little bit weakened, and your ability to advocate on your own behalf is challenged. And if I could underscore one big aspect of this program, it's the ability to advocate on your own behalf. So when you enter the workplace, you have the knowledge and the skill set and the confidence to be able to approach the documentation and the supervisors to make sure that you understand exactly what's expected of you, and more importantly, that at the end of the day, you're able to go home and enjoy the fruits of your newfound labor. An ounce of prevention is worth a pound of cure, to default to an old cliche, but cliches are cliches because they happen to bear some truth. And when we teach this program here, that's exactly the ethic we're trying to promote. Be proactive, be aware of what you're going into. We see the confidence spiking in people in this program here.
I think what we're seeing with the youth, and I'm going to say marginalized youth, right? Youth that have had many barriers in the past. I think what we're seeing is that programs are starting to support those gaps, yet the youth aren't necessarily aware of what that support looks like. So one of the things is when you are working with youth and you have their buy-in and they see the value in continuing the training, you're onto something. And our hope is that when they walk through the door and they know that they're going to walk out with a certification or a ticket, and that they've actually completed it, that they've been successful, it's that success that gives them the momentum to continue. And that's the biggest key. Many of these folks had a lot of failures. And when you talk about continuing education or going back to school, the last thing they want to do is to set themselves up for another failure. So what we're really doing here is we're setting them up for success. And we're supporting them in literacy and basic skills programs that are you can develop deliver one-on-one training. And that they know this isn't the high schools that the educational environment that they weren't successful in the past. This is a different mode of training. So our hope is that, again, we will start to get more buy-in, and they talk to each other as well, right? That word of mouth referral is a key piece in literacy and basic skills. So we're hoping that we can take this and continue on a trend of letting them know that success is possible and that jobs are possible, and they don't need to be afraid of the prerequisite training that's required for that position.